Hello and welcome to the Care for the Carers online Carers Voices conference, our live Q&A today. We're absolutely delighted to see you today. My name's Jennifer Twist. I'm the Chief Executive at Care for the Carers, and really pleased to have 15 carers with us today in this session, and also a handful of professionals who've joined us to hear carers' voices. And everybody's watching live, and also will be able to watch back after the session. So I'm really delighted today to be joined by some fellow panelists. So firstly, welcome to Emily Holtzhausen, OBE, who's Director of Policy and Public Affairs at Carers UK. I think Emily will pop up on the screen. Hi, Emily, welcome.
Thank you.
And also welcome to Tamzin Pitt, who's our Strategic Commissioning Manager at East Sussex Adult Social Care and Health.
I'm afraid
and Tamzin's, I think Tamzin,
yeah,
I think she's had a bit of a Wi-Fi problem, so she'll be back with us. We were just talking to her. She'll be joining us imminently, and we can say hi then. And then last but absolutely not least, welcome to Jo Egan, who is the Director of Services at Care for the Carers. Hi, Jo.
Hi, great to be joining.
And also, we were expecting to be joined by Gareth Howells, who's the Chief Executive at Carers Trust today. And we're also just chatting to Gareth. Unfortunately, he's needed to go off and deal with an emergency, so he sends his apologies. And Emily has very kindly said that she will fill us in on some of the national developments that Carers Trust are working on. And obviously we can also feedback any additional information after the session. So we'll get stuck into some questions shortly. Firstly, let's welcome Tamzin. Just while Tamzin gets settled in, I should just say thank you to everyone for bearing with these sessions being done from our various kind of dining rooms, kitchens and spare bedrooms. We may well have some issues with Wi-Fi and things like that, but we've got some help behind the scenes, and if any of us need to kind of reconnect, we'll be back with you as soon as we can. So welcome, Tamzin. Hi, Tamzin.
Thank you.
I don't know if you can hear me okay. Thank you for joining us.
Yeah, I can hear you. You're breaking up a bit. But yeah.
Okay.
Shall I introduce myself? Hello, I'm Tamzin Pitt. I'm a commissioner. I'm a commissioner in adult social care for East Sussex County Council.
Thanks, Tamzin. I think we've got a slight delay as well, so we'll stick with it, and hopefully we'll be okay. So before we get stuck into some questions, just a few housekeeping points to note. So we'll be putting your questions, so carers' questions, to our panel, and you'll see those questions come up on the screen as we're talking through them. So do keep an eye on that. And also we have to the right of the screen, there is a chat area which we'll be keeping an eye on. So really looking forward to hearing your questions throughout the session. And what we'll also do is we'll do our best to pick up all of the questions here today, but as you know, we always pull together a report from our events, so we'll be including both the questions and answers in the conference report. And also we'll be taking notes from today and using your anonymised feedback through that report. So do remember, some of the issues we will be talking about today may be quite personal or may be quite sensitive, so please do just share the things you feel comfortable sharing. There's no pressure to go beyond that. So if everybody's happy with all of that, let's get started. So I'm just looking to see if we have any questions here that have already come through, and I can't see any at the moment. So we do have some that were sent in to us in advance. So I'll make a start with those. And this is a kind of national question. It's really, really important for carers. and I think quite a topical one as well. And it's about carers allowance. So the question that's been put is that the level of carers allowance is essentially an insult to carers. It's the lowest benefit and also not available to many carers. What's being done to change this? So I'm going to direct that question to Emily, please, if that's okay. If you could just give us your thoughts.
Yes, of course, and thank you. And thank you to the person who put that question in. The person who put that in has basically framed that question for about 900,000 people, 1 million people. So that's, people feel very, very strongly about this. Of course, it is the lowest benefit of its kind. It's only 67.20/25, and I don't think Carers UK ever lets up from campaigning on this. Scotland have got their own legislation. They're able to do what they wish to, and in this in-between time, it hasn't quite fully established yet. They've given carers an additional supplement, a carers allowance supplement, which is worth approximately £230 every 6 months. So it's not quite the same as evening it up, but it's about the same as evening it up to job seekers allowance. And during this time of COVID, what they've done is doubled that payment. So it's not quite the same as the extra amount that people get on universal credit, but it is more. And it's great that Scotland have done that, but we just don't think it's fair that we have this low level of benefit on carers allowance. It simply has to increase. And during this time, simply because people who are on carers allowance, they've not got this extra increase that universal credit recipients have. And we need to see that changed. So I was delighted. We sent a letter with 91 other organisations, which of course included Care for the Carers, East Sussex, and Carers Trust, to both the Secretary of State and the Chancellor, saying this must change. We need to value carers. Carers have done an extraordinary amount anyway, and more so during this time. And as we go back, as we look at emerging out of COVID, at some point we need to see an overhaul of carers benefits that really recognise the enormous support that people give. Things like the earnings limit changing. We've got a whole long list, but that, for starters, is something that we'll continue to campaign on, and with our colleagues here from Care for the Carers East Sussex as well.
Thank you, Emily. Yeah, we were really pleased to join you in and to sign that letter with you. And just to sort of take that a little bit further, what sort of time frame does it tend to be that these things get looked at? What response do you expect to get from such a powerful statement, really, that's come from the community of carers?
Normally we would expect to get a formal response back from the ministers within 3 weeks, but sometimes things take longer during this time. And it's not the only thing that we've done. Of course, there have been regular calls. There've been we've contacted the Work and Pension Select Committee within Parliament. There are questions going down in Parliament all the time, and you might have seen the Prime Minister possibly during PMQs, Prime Minister's questions say that these benefits, these old style benefits, they're called legacy benefits, would not increase. And so all those people on income support are not getting the extra cash which they so desperately need. So Jennifer, in 3 weeks' time, we will definitely let you know and let carers know, and then we'll move forward. We're not going to let up, I think, in keeping the pressure on government about this.
Thanks very much, Emily. Thank you. So there's no live questions come in that I can see at the moment, so I'm going to keep referring to the ones that have come in advance here. And bear with me. So this next question is a question, it's a more local one, and it's kind of to do with the NHS and social care. So this is somebody who's recently had quite a difficult situation. They were recently turned away from their own scan appointment because he had his wife with him. his wife has dementia and can't be left alone. The carer now says they now know from Care for the Carers that they could have received a grant to pay for replacement care, but there was nothing in their appointment letter that indicated that they wouldn't be able to take their wife into the appointment like they normally do. And they found on the day that there was quite a lack of flexibility and that they weren't really recognised as a carer, and they still therefore haven't actually had the scan that they really need. So what, I don't know, Tamzin, if you could give us a sense of what is happening locally around, I guess it's communication between health and social care in this instance, because they were, they're registered as a carer, this person, and yeah, ensuring that the NHS can respond and support carers in that situation.
Well, yeah, I mean, just first to say that obviously we don't have a shared database with the NHS. So even where adult social care knows that somebody is a carer and looking after somebody who can't be left alone, we wouldn't be able to share that information with the NHS. So it would be for the carer to let their GP and other clinicians know about their caring responsibilities, to have that recognised. We do fund alternative respite for carers so that they can attend their hospital appointments and have the cared for person looked after. And perhaps we need to do more to promote that service. And I think this is an extraordinary time where nobody is allowed to take anyone into hospital with them, other than, I think, women giving birth. So this carer wasn't singled out. That it's something that is happening in every hospital in the country at the moment, in terms of people not being able to take other people into appointments. So, but I think you're right that the letter should have highlighted that to him at the time. So that's something we can feed back to the hospital, and check that they're doing that. Although yes, and I don't know if that it may have changed by now. I don't know if people are now able to have somebody with them in hospital. I don't know what the latest guidance is for hospitals.
Thank you, Tamzin. And certainly at Care for the Carers, that's something we can support as well, that communication with the NHS locally. And we may want to just think about the carers card in that situation. But Emily, you were waiting to come in.
Yeah, I think there's a national question to answer on this as well, don't you? And it's a long-standing one, which carers have said. Imagine if the NHS did recognise carers. Imagine if that was on the carers' patient records systematically, that secondary care, hospitals could see and would understand. Imagine if hospitals really understood dementia well, and learning disability and autism well, and where people need to come, where they're not necessarily safe to be left alone. I think this is one of the things. There are some things that we've come through this process going, if we'd had that before, we might have been better prepared in some areas. And those areas, I think, are GP practices where we have all those proper records, and that there are agreements to share data so that carers are not passed from pillar to post, and that they understand. So I hope we don't lose sight of, I think we've always had that vision within the carers sector, and certainly our colleagues within local authorities have championed that way forward as well, and would like to see that happen within the NHS. So I hope that's something that we can see going forward. And the carers card, I mean, has been a really important measure, and I think it's something which, I certainly encourage carers to look at, and I know you'll build on in the future.
Yes, absolutely. And I wonder if it's worth asking Jo just to say a few words about the carers card in East Sussex and what that's about and how it works.
Yeah, absolutely. So we're just picking up on the earlier point. I think there's an action coming through here around something that perhaps we can do jointly with East Sussex County Council and Health to be thinking about actually some standard phrasing within appointment letters. You know, could this be something we take to a strategic level to the kind of heads of the various local health organisations to be looking at actually could there be some text there that refers to, as you say, Tamzin, the fact that there is replacement care available, there's a grant available for that, which we at Care for the Carers administer on behalf of the local authority. So actually trying to use those tools that the appointment letters are going out anyway to communicate wider around that opportunity. But yes, the carers card in East Sussex is very active. We've seen an increase in sign-ups during COVID, as you'd expect. So in the last quarter, we had nearly 400 carers signing up, and there's thousands of carers who already have a carers card. So in East Sussex, it has 3 functions. One is to identify you as a carer, and that function has been the most popular, and that, you know, that behind why we've had such an increase in sign-ups, as people have needed to kind of prove that they're a carer in order to access things like supermarket priority shopping slots. The second function is to have an emergency plan if that's something that the carer wants to have in place, so that in the event that they were unable to conduct the role that they have in their caring role, that emergency provision could be put into place. And then thirdly, it also comes with a discount function. So we have a number of local and indeed national businesses, retailers, all providing different offers for carers to help out help carers in their caring role. So that, you know, is an added benefit to having the carers card, and very popular.
Thanks, Jo. Just a question that's come in from the floor. I've got a couple of questions, and we'll come to Ros shortly. But before that, we've just had a question come in from Nigel Coomber about the carers card. Can you just talk us through why we don't have personal identification on the card? Because I know that's a question we've been asked before, and it does sometimes prompt questions from people, but I know it was something that we weren't able to do. But can you say a bit more about that?
Who are you directing that to, Jennifer? Me or Tim?
Sorry, Jo, can you take that one?
So yes, so that was it used to have an identifying code on it. Within the last year or so, maybe 18 months, the provider for the carers card emergency plan shifted over to it went into adult social care. At that point, it was reviewed as to whether the reference code was ever needed. And actually the decision was taken that, you know, it prolonged the process for carers to receive their cards. And actually, in terms of the use of the card, there wasn't an apparent need for that kind of personal identification to be on the card. So the advice we give to carers is to keep hold of your card in your purse or wallet, because you usually would have that about your person. Your purse or wallet is likely to have other things that identify you. So if in the event that you're unconscious and not able to identify yourself, then your bank cards, etc., would be used for the identification element. But the actual card itself doesn't feature personal information, because it felt like it was an unnecessary step being added to it. I don't know if you want to add any more about that decision making, Tamzin. I'm not sure if you can hear us, Tamzin. Do you want to add any more on that? Oh, no.
Oh, we've just lost Tamzin,
okay.
Actually, Jo. I think she'll be back. And certainly what we can do, Tamzin, don't know if you can hear me okay. We were just finishing up thinking about the personal identification on the carers card, and just wondering if there was anything we wanted to add, because I think the key thing is that this is a project that...
Yes, sorry, I can't hear Jo very well, but...
Over to you, Tamzin.
So what we are doing with the new batch of cards that have just been printed or are about to be printed, I'm not sure, Jo, is that there will be a signature strip on those cards, so that people can, if they choose to, put their name or their adult social care ID number on that strip if they choose to.
Yeah, I've forgotten that new development. That's hot off the press, isn't
and
it?
it's really good. It's also really good to have the feedback as well, so that can all sort of factor into future planning too. Moving on from the carers card, as I mentioned, we have a query from our colleague Roz at Amaze, who's on this call representing carers of disabled children and young people, and she's saying that as we've heard quite a bit about in the media as well, that carers of disabled children and young people are exhausted after 3 months without their children going to school or college, and often without some or all of the short breaks or support from personal assistance that they usually have. Now they're facing the challenge of the summer. So what does the panel think can be done to sustain parent carers and avoid crisis? So if I go to Emily first for the national perspective on that, would that be okay?
Yeah. Yes, of course, I'm very happy to do that. And it's something that came out very strongly in our research. The research that we did, Caring Behind Closed Doors, looking at carers' experiences, there were certain groups of carers that were finding it especially tough, and parents of children with quite complex disabilities and especially with challenging behaviour as well. So it's a very good question from Roz. It's something we've pushed a lot, and as we're seeing services open up, we've made breaks a priority for all our asks, along with things like carers allowance, and breaks for people of any age, really. I think the conversations that we've had with the Department of Health and Social Care, I realise it's not necessarily parent carers, but across, is that they are concerned about this. We've also pressed for more guidance for services that are opening up, because a lot of them are run by voluntary organisations or private organisations, and they want guidance as to how do we make sure that our services are safe. But part of the challenge is the capacity, whereas you might have taken 20 kids before with social distancing, you might only be able to take 5 or 10. So, and obviously some parents are really worried about shielding still, although that technically ends on the 1st of August. I think it will take people a long time to readjust and feel confident. So I'm hoping that some guidance will come out, certainly for adult services. I'll look into whether it's coming out for children's services, but we've asked for that. And I know that some local authorities and some services have really tried to run online services to engage the child, and some have been quite creative. I heard of a direct payment the other day, a personal budget given to a carer because their child couldn't go to physical play and therapy sessions. They paid for some play equipment for their garden, so that they wouldn't normally be able to afford that, and that enabled a change for the child, of course, but also a break for the parent. But I would say that this is on the very high on our urgent list, very high.
Thank you, Emily. And I know also we've been echoing, and with the support of Amaze, where Roz is from, the particular issues for this group of carers, and we're really pleased that some of the carers who Amaze is in touch with put together some video diaries of their experiences through the coronavirus, and they've been featured on the local news and things like that, and are also included within the conference page for this wider event that's taking place through July. So we are continuing to push those messages through the media. In terms of direct support that Care for the Carers is able to provide for parent carers, I don't know, Jo, if you're able to update a little bit about what we're hoping to offer soon.
Yes, absolutely. I mean, I would echo what Emily said about this is a particular carer cohort that we are hearing from regularly as being very much in crisis during this time. often living in very busy households with, increased chaos because of all the kind of removal of the normal coping mechanisms and structures that would have been in place for the disabled child or young person. So definitely a group of carers we're hearing from regularly, and similarly, very much on the top of our list to be trying to address those immediate needs. So we have a funding bid pending for a continuation of our parent carer wellbeing programme. So we had a successful first year with that. It was a fairly small project, but we did have lots of carers come through that and access some courses to really look at tools around kind of building resilience and support structures to help them in what is often a very challenging caring role. So we're just waiting on the kind of news around whether that will be able to continue, and obviously that may well need to be an online offer depending on how things progress through the course of the year, but we hope to be out through that to be able to offer at least 4 wellbeing courses, probably with the first couple starting in September, in acknowledgement that hopefully there'll be some kind of schools provision in place to make it more possible for those parent carers to participate. And there is, obviously Amaze is commissioned to deliver parent carer services, so we very much work in partnership with them. Our single access point, our carers hub, is open to all carers, including parent carers. So often we'll have parent carers coming through to our helpline, to Carers Hub, potentially reaching out for the first time, hearing about the services available to them. So we make sure that we deliver a kind of personalised response about, well, what's best going to meet their needs, making sure they're referred to Amaze, engaging them with the East Sussex Parent Carers Forum, and looking at the various parts of our offer that are open to them, such as receiving our care line, our quarterly magazine, accessing any of our activities programs. They are usually accessible to parent carers. So in the normal run of things like spa days and things which are really valued for parent carers, by parent carers. But there's more to do, clearly, and that's something we're keen to really broaden the offer, so that every single carer in East Sussex, including parent carers, has a really comprehensive range of support available.
Thank you, Jo. And I think the other thing is, it's really great to know that that a colleague from Amaze is taking part today. So if I can ask Ros, if there's anything that you would like to make sure that carers watching this back can access in terms of information about your services, please do let us know. Obviously, we also have a video in the marketplace for the conference from Amaze as well, which talks a bit about your services. But if there's anything else you'd like us to share, then please let us know, and we'll make sure that we do that.
Also, just worth noting, Jennifer, just sorry to interrupt, just worth noting there is a specific workshop, one of the carer workshops is specifically being facilitated by Amaze and the East Sussex Parent Carer Forum, coming up, I think it's next week, that one. So definitely well worth participating in that, if that's the kind of carer cohort that you fall into.
Definitely. Thank you, Jo. Thanks. So waiting for some new questions to come through from the floor. So I'm going to go back to the ones that we had in advance. And my screen's moved forward. So this is from a carer who's juggling work and caring. And basically it's a battle. So any time this person needs to take any time off from work to take their mum to an appointment, it's just a real battle with their employer. So they are actively thinking about giving up work. And the question is, why don't carers have a legal right to time off work? So I'm going to pitch that to Emily.
Oh, I absolutely want to answer this question. It's so important. So if I give you a few stats that we've just looked at the moment, if you think you're alone, you're certainly not. With the research that we did for Carers Week, 4.5 million new carers, 2.8 million of whom we think are juggling work and care. That's a huge number of extra people who are juggling work and care on top of the numbers that we think are already out there, bringing it to maybe about 7 million. But you can often feel quite alone in this, can't you? And we find that people don't share their caring experiences at work for lots of different reasons. If we were to turn the clock back, it's very similar for a lot of women and men, and their own children within the workplace. And that has changed nowadays. We want to see this changed for carers. So here comes the opportunity. So we've been campaigning for a very long time for carers to have a right to take time off. We'd like a bit of equality so that people caring for adults and still for and for disabled children, of course, can take that valuable, that really important, valuable time off. So government has a consultation at the moment out on carers leave, and Carers UK has a section on its website about it, and that would be to take 1 week's unpaid leave. And what we're saying is we would like to see that taken in maybe half a day or up to a week, with small amounts of notice given. Of course, we would love to see this paid, and we would love to see it for 2 weeks, up to 2 weeks every year. But so of course we're asking for that from government. But even if we were to get this 1 week of unpaid leave, it would change the dynamic for carers. Carers would have to be more visible in the workplace. All employers, large and small, would have to think about carers and would have to think about their policies in relation to carers. Now, sometimes we get asked, oh, well, won't this open the floodgates? And the answer is no. There is no evidence for that anywhere in the world. Where people have more generous policies across the world, this does not happen. Carers by nature plan, they're cautious. I don't know if I might need it later. I'll only use what I need. And I'm also conscious of my work colleagues and having to reorganize my work in order to enable this to happen. So people are conscientious, they're thoughtful, they value it, they're sensible with the amount of time. So I would really, if you're juggling work and care, or you work for an organisation, organisations, please put in a response by the 3rd of August. The worst thing that can happen is that government doesn't think this is important to us. And this would be such a big step forward for us. If you're a carer, a parent of a disabled child, these are the kinds of rights that you need as your child becomes an adult, because you don't then have the rights to take planned leave as your child turns 18. That's it. No longer any entitlements to parental leave. So please respond. And Jennifer, if you want the link and you're communicating with everybody after this, I'd be more than happy to give you the link so that people can respond. It would really help us. And say you're in favour of it. Obviously say that you'd love to see it paid, but we have to make sure they know loud and clear that this would be an important step forward for carers.
Okay, great. That's really good to know about. So we, as you know, we do quite a bit on social media. So what we can do is also share that link on our Twitter feed and on Facebook. And obviously we'll put that information in with the information from the conference as well. And I think it may be worth also, you talked about kind of raising the profile of carers generally with employers, I guess. And I don't know if it might be worth just talking a little bit about what we're doing locally around that. If I start with Tamzin, I know you did some great stuff in Carers Week at the County Council. I don't know if it's worth talking a bit about that, because I think there's something about leading by example. So it was really good to see an organisation sort of speaking up and inviting their employees who are carers to identify themselves, to speak up, etc. So it's slightly different to this kind of legal right question, but you did some supportive activity in Carers Week for the staff, I think. That was for Tamzin. I'm wondering if you can hear me. Yeah.
So East Sussex County Council, as an employer, does have a policy for staff who are juggling work and caring, and has certain sort of practices in place around taking additional leave and so on. Unfortunately, not paid either. But carers are supported. They're also supported to work flexibly or to amend their hours where they need to. During Carers Week, we held a virtual meeting for staff who are carers, and we're going to be continuing to have those meetings as well. And we're going to be looking at the information that is given to staff about caring, and looking at what might need updating, and involving some of our staff who are carers in working with human resources to address some of that.
Thank you, Tamzin. Thanks. We can maybe say a bit more. We'll move on to another question for now, but if we have the time, I'll maybe come back to Jo and ask you to say a bit about our carer-friendly communities work, because that's about raising the profile of carers with employers, but also more broadly. So we'll maybe come back to that. But in the meantime, coronavirus is one of the, obviously it's just been an extraordinary few months, and we've certainly been reflecting at Care for the Carers on the huge, just phenomenal impact of the pandemic and lockdown in particular on carers. So obviously for everybody it's been a hugely stressful time, but for carers it's just on top of everything else. And there's one of the questions that's come in advance has been about something that I've talked quite a bit about on my Twitter feed, which is the clap for carers, which on Thursday evenings, obviously we got together and showed our appreciation for the NHS and just the phenomenal efforts from the NHS staff, care workers, etc. But for carers, unpaid carers, so carers as in our definition, it was quite problematic. So this person has said the clap for carers wasn't actually for carers, but it was for paid care staff. And that says everything that you need to know about how the country completely ignores and undervalues unpaid carers. Will it ever change? And I just think they've expressed really powerfully kind of that issue with recognition that certainly that we saw from central government, even during Carers Week, not completely recognising carers in their own right. So I know it was something that we were getting very frustrated about at Care for the Carers. I don't know if you want to add anything to that, Jo, while I put my earphone back in.
Yes, I mean, that's something we heard very loud and clear from carers, that kind of frustration, not wanting to take away from the gratitude and recognition of, the key workers that are, have responded to the crisis, but really frustrated that this was an opportunity to recognise carers. And at the core of that is, we know this is such a major barrier to carers accessing the support that's available. So we know far too many carers don't identify as a carer because there's such confusion about the term, and it is the term we're stuck with. It's not the ideal one, but it is the term that we're generally using. But so many carers are just not thinking I'm a carer and therefore I can access the carer support that's available. They're thinking I'm doing what I'm doing for the person in my life that I've ended up caring for. So they then will come to us and say, why did my GP not mention you 10 years ago when my wife got the diagnosis? Or so it's been a real key issue for us. It's clearly a big part of our work is about challenging these barriers to identification, and our Think Carer training program, that's kind of one of the key aims, is about encouraging and working with our partners in the community to identify carers, because we absolutely can't do that alone as carer support organisations. It needs to be a whole community response to carers, to to identify, to noticing where it looks actually like you're in a caring role. Did you know that there's support available? Let's get you to that support. So that's a core theme throughout our Think Carer training programme. As you mentioned, Jennifer, we have our carer-friendly communities work, which is, you know, the training programme is a part of that, but it's a wider package around working with local employers around actually having carer-friendly employment policies, so things like carers leave, etc. But yeah, there's still a long way to go, and actually because of the nature of caring, there's a constant churn. You know, we will never get to a point where we've arrived at, you know, these 7 million carers all having the support, because there's a constant churn of carers coming to the end of their caring role and new carers coming into the caring role. So it's a, you know, continual process that we need to spread the word.
Yeah, thank you, Jo. Yeah, and I think there's some real tensions as well between the word carer is the word that sets out in law what carers' rights are and kind of, you know, gives them those rights. So in the Care Act, it says these people are carers, these people are not. And so it's, you know, we feel quite passionately that's carers' word and you know, to be owned by carers. But as you say, that kind of reaching carers early on in their caring role, it's quite tough, because often we use that word to mean other things as well. But Emily, what's your sense from a national perspective, and what did the government come back at those kind of questions during Carers Week?
No, well, if we think this started quite early, didn't it? Within COVID, so, and then NHS Clap for Carers would have established that word for people who were paid. And if you look at all of the names of our organisation, Carers UK, Carer for the Carers, Carers Trust, this is stuff that we've those are hard won rights, but it was, so we had to adjust within that time. And now with our briefings, we talk about unpaid carers. I would love to get back to a position where carers was our word, but it was quite quickly taken over by others, and you know, and other people who do really important work. So I was also slightly frustrated as well by not recognising the work that families do to support relatives, families, and close friends. And so it wasn't until quite late on, and we asked for those daily briefings to recognise what families were doing. So that came later. It did come before Carers Week. There was one small mention, and then during Carers Week. But as we go on, I don't really know what the future holds. Do I think that carers need better profile? Of course. So we have got, funnily enough, when we measured how the increased awareness, and I put it in my presentation, we're possibly at the highest level of awareness of carers that we've ever had. Interestingly, amongst the general public, perhaps we need some services and government to catch up and capitalise on that. But there's so much more work to do, on this.
Thank you, Emily. Thanks. So I'm just seeing, I can't see any new questions from the floor. So we've got one more question that came in advance, which was to say that we've heard a lot recently about Black Lives Matter and how COVID-19 is affecting Black, Asian and minority ethnic communities. What are you doing to make sure that carers from these communities are supported? And actually, I think we've got a bit of time. I don't have any other questions pending. So I think maybe we'll see what's happening kind of at the national level and locally with this one. And maybe, Jo, can I put that to you first? And
yeah,
I know we've been doing a lot of thinking at Care for the Carers.
Yeah, absolutely. Yeah, I mean, it's clearly had, you know, a lot of attention recently due to the, you know, recent events, but it's been a core theme of our strategic planning work to be addressing the gaps in terms of our reach to hidden carers, of which BAME carers are one of the kind of groups of carers we know we're not reaching enough. So there's been a lot of work over the last couple of years with our equalities action plan, trying to really address the multiple barriers that we know that these carers are going to face or do face in terms of accessing support, or even again back to the identification issue of actually self-identifying that they are indeed carers and therefore can access support. But then the additional barriers we know are faced around feeling able to trust organisations like ourselves around, you know, what kind of response will I get, and will the service respond to my individual needs. So we've been working alongside various community organisations to try and address those barriers in a kind of intelligent and meaningful way. You know, we're not here to tick box, you know, that we've attempted and it failed. We really do want to achieve change. We've been focusing a lot on our messaging and our communications, because we know that's a key issue. But you know, how do we demonstrate and kind of reach these carers? Is about, you know, our imagery, what we're saying about our services, the language we're using, and how we're overcoming the barrier around, you know, well, it has for an individual carer to make the connection that actually we're talking about them, you know, that this is, you know, who we're talking to. So still lots of work to do. It's very much a priority issue, and we're looking forward to making more change in the months ahead.
Thanks, Jo. Tamzin, from East Sussex County Council's, from the council and possibly NHS work as well. I don't know if there's anything that you can share.
So
I think the Wi-Fi.
We're certainly looking at all our equalities and diversity and thinking about how what we might need to improve on or do differently. I think we were thrust into the code work so quickly that we weren't able to build in the monitoring that we would normally do when we're developing new areas of work. And the information about the impact on Black, Asian and minority ethnic people of COVID obviously came sort of part way through our response to COVID as well. So I think we've got a long way to go, as do all organisations and individuals, to address some of the issues around disadvantage and stigma and actual racism. And what I do know is that the County Council is taking it very seriously and is addressing some of those issues and looking at how we, do things differently going forward. Certainly also how our response to COVID-19, should there be a second wave of any description, how we support people in that time.
Thank you, Tamzin. And Emily, I guess this has been a huge debate nationally as well, I'm sure.
Yes, and it's brought a really helpful focus actually on a particular a group of people. I think everybody has started to look, you know, the data sets, for example, that feed information through, where we collect ethnicity data, where we don't. I think it's been a really, really helpful focus, and I'm really pleased to see a lot more organisations doing different things and finding out where the gaps are and where they need to be plugged. And I think that's really helpful. And I think what I also think will be very helpful will be strong voices going forward and staying there and making sure that this continues to be part of the conversation as we go forward, as we shape services a long time into the future. So I think I really welcome the renewed focus on this. It's really, really important, and it's important to people's lives. It's very important to get right. So it's good.
Yes, thank you. So and Care for the Carers, as Jo said, that we're very conscious that we, as we've all said, that there's a lot further to go, and you know, for us, we're really keen to be working in partnership with our colleagues across the sector and across sectors as well, to be building connections within and across communities, really. So I guess in terms of partnership, it's just worth me saying again, thank you to our colleagues and partners who've provided information in the marketplace for this event, and just kind of giving that a bit of a plug. We're coming towards the end of this session. I'm keeping a keen eye for more questions over in the chat area. There's none coming through at the moment, but I'm just going to do a call and
Jennifer,
see.
there are a couple that have come through.
Are there?
Yes.
I've not
So,
got them on my screen. Right.
You've got them.
Okay. They stopped appearing at the bottom. I was thinking we had none. Right, let's get back onto these questions before we do a bit of a roundup then. So, so this is from Kate Richmond. Given the COVID issue and the bleak economic landscape, what impact do you anticipate this having on home care and on care home provision in East Sussex? And what changes can carers expect in the next couple of years? I guess that's most naturally fitting with East Sussex County Council. Tamzin, if you'd be happy to take that question.
If that's aimed at me, I'm sorry, but I didn't hear any of it.
Oh,
I'm
sorry.
really struggling to hear
Also,
anyone
you should
else.
be able to. Are you okay? I don't know if we've got Nikki helping us behind the scenes.
Chat room.
If you look in the private chat, you can see Kate's question, but it's about just really how difficult the financial position is at the moment. And do you see that there?
I'm emailing over to you, Tamzin, in case that's easier for you to see.
So in the meantime, I know
happy to come in on just what it's going to mean, because it looks like
I was just going to say
it's certainly what it's going to mean in terms of the changes to care for the carers services over the next couple of years. We're very much mindful that we are in this bizarre and unprecedented time in terms of service planning. So we have actually got a live carer survey out that went out yesterday and runs through to the end of July, to specifically ask the question around actually what do carers want as a priority in terms of the resumption of face-to-face services. Because as you know, as schools go back, as you know, pubs and hairdressers are obviously open, we are still in this scenario where the government guidance is that we should work from home where we possibly can. But that then has an impact on the ability, and if it's safe even at this stage, to be considering resuming our face-to-face groups, one-to-one counselling, face-to-face counselling, face-to-face advice and guidance sessions, things like that. So we want to understand better from carers, actually, even once it is acceptable within the government guidance to resume those activities, actually what do carers want? You know, as Emily mentioned, you know, shielding may be coming to an end, but the confidence levels we expect to be low. So we're kind of preparing for the possibility that actually carers won't want to come to the face-to-face stuff, and we'll be wanting to carry on using the phone and online services, because all of our services have adapted to be offered by phone and online for the foreseeable future. So we're keen to hear if that's, you know, a correct guess, because a lot of it is guesswork at the moment, because we just don't know, and obviously we don't know how the kind of infection rates are going to pan out, whether there'll be a second wave, and so on. So it's very much the $64 million question at the moment as to actually what does the future hold. And I think you're right, Kate, that that's even more compounded in terms of care home provision and home care, given that that is a sector that's been so significantly impacted by the pandemic. What we're hearing just at a local level is that there are a significant number of home care agencies who do still have capacity. And I appreciate that's not available to every carer, you know, depending on their kind of financial situation. But we are, you know, we have been in touch with a number of the kind of local home care providers and did identify several who were saying, no, we have still got capacity, we've got PPE in place, and we are able to come provide that care. So certainly our advice would be to get in touch with our team if that is something that you as a carer are kind of encountering as a difficulty, and we can direct you to, you know, certainly the information we know locally.
Thanks, Jo. And so I think the other thing that we've maybe not mentioned is that so as you say, we're consulting with carers at the moment about their experiences. And from our perspective, it's making sure that Care for the Carers is doing everything we can to bring back as quickly as we can the services that carers are missing the most, the things that are the real priorities for carers. But we're also going to be working with East Sussex Community Voice to do some consultation with carers or recent carers of people who are in residential care. So that's something in the coming months that we hope to understand a lot better from their perspective. So yeah, thank you very much for the question, Kate. And sorry I missed it at the beginning. I can also see that we've also got a question from Esther at Project Artworks, who is saying that family carers have been overlooked during the pandemic. Access to PPE has been a big issue for families who are employing PAs through personal health budgets or DPs. Why have family carers been forgotten?
I'll take that one.
Put that to you, Emily, if that's okay.
Yes, I've raised this from day one. From day one. So the message about people, not just carers, but individuals employing their own PAs through direct payments was listened to very late on, but that message was said loud and clear from colleagues who use direct payments themselves and advocated. You can see there's been a hierarchy: NHS first, and then social care second, direct payments third, and then at the back of the queue are carers themselves. And so it's a very frustrating situation because not that many carers need it. There are a few particular situations where carers don't employ people, but still need the PPE. So Scotland have a system, and we have sent all the information to the department to say Scotland has this system. We've been unable in Wales and Northern Ireland to get the same system as Scotland. It's something that's still on our agenda. It's not going to go away. Some local authorities have managed to sort their own systems locally, and that's something which we said is a prerequisite going forward. And of course, the other point about PPE is we've been talking earlier about the question about services opening up for parents of disabled children and anyone else. For services to run, services have to have great PPE for people to have confidence. Until that time, we're told we don't need it. It's an absolute necessity. It's a foundational service, really, that breaks are quite often based on. So, and services for disabled and older people. So certainly hasn't gone off my agenda, and I'll continue to raise that. So thank you, Esther. Very, very good question, and I hope that you'll continue to raise that yourself, and particularly with your local MP as well. Why not? Let's make sure that they know exactly what carers want and need.
Thanks, Emily. And I suppose on that last point as well, if carers watching this are saying, well, I would like to raise that issue with my local MP, please do get in touch with Care for the Carers and we can give you a hand with that. We can share contact details or anything else that might be useful to you. So I'm conscious that time is tight. Thank you for all of those questions. I'm sorry I missed some of them and needed a bit of a nudge on using the technology there. Before we finish, one of the things that's come through as a bit of a theme, I think, through our discussions is we've said a few times there's lots more to do. So I guess one of the things we thought we maybe would think about before we finish is what are the challenges and solutions and actions that are needed. Maybe if I could just say very briefly, because of the time, but Jo, what have you got? Maybe a top challenge, solution, or action that's needed, and then I'll come to you, Emily, and ask the same.
It's hard to condense it as we are tight for time. I think a key theme that seems to come through is communication. It just needs to be better, whether that's around appointment letters from the NHS or the messaging that government is giving out and the confusion around carers and care workers, or accessing the information about the services that are available. Communication seems to be the theme that's come through today, and obviously I've noted down the various kind of topics and things, and we'll make sure we take those forward in our Carers Voices work and probably come back to them through the course of the conference workshops that are taking place.
Thank you, Jo. Emily?
I haven't really mentioned these things, but I think I should, as a bit of a cheeky last word, is rehabilitation, reassessment, and mental health support. So mental health support, absolutely critical. So the services that Care for the Carers have, we know that mental health has not been great for people, worse for some people. So we need to focus on that. But also, we all know how people's conditions have deteriorated over this time. So what do we need to rebuild people's abilities and their skills? I'm not just talking about carers, I'm talking about the people that they care for largely, but also carers themselves, of course. So those things will be a focus for us going forward, so that people can rebuild their lives and regain the skills and abilities that they had beforehand as much as is possible.
Thank you, Emily. And I think for me, I'm really looking forward to, I think the key message is there is a lot more to do, and I'm really looking forward to hearing everything that carers are saying to us throughout July, through this conference, and also through the consultation that we're reaching out to them with at the same time. So obviously Care for the Carers will be keeping those carers' voices at the heart of all our planning and what we kind of do next to respond to carers at the moment. There's a few messages to kind of give just before we come to a close. That does bring us to the end of the live Q&A today. Really, really grateful to all of you for contributing. We'll be publishing a summary of the discussions from the Q&A during the conference. So please do keep an eye out for that. And remember that it's not all over after today. There's lots more on the website. And we really do want to keep hearing from you throughout the month. So please do send in any other questions. We will follow up and get answers to those. And we also really want your views as well. There are several other workshops taking place during July, so please do join us at those. If you've not already booked your place, you can do so right up until the day that they're on. I think there's just a couple of hours notice we need. So everything that we're hearing from you is going to impact on our awareness raising work, our services, and all the strategic work that we're doing to influence both statutory and voluntary sector partners responses and support to carers. So if you've given us your email address, we'll send you a copy of the conference report in due course, and make sure that you're still connected with the conversation. Also, don't forget that there is support from Care for the Carers and our partners. So please do get in touch if you need any help in relation to your caring role, either now or in the future. We're always on the end of the phone. And finally, if you haven't already had a look, please do take a look at those films on the conference pages of the website. So you've got the films from carers that we've already spoken about. We've also got the keynote speeches from Emily and also Gareth from Carers Trust. And there's also some bit more from Joe and I on there as well. And all of our local partners who've contributed to the marketplace. So please do keep involved in the conference. It's great to have you here today. Thanks for helping us start it off. And big thank you to Emily, to Tamzin, to Gareth, who we didn't get to see, but who will help us with any Carers Trust elements in response to those questions. And also to Joe, thanks very much. And I hope to see you soon.
Goodbye.